Okay, so you may have heard of the SPRS system. Hopefully you've heard of it by now. That stands for Supplier Performance Risk System, and it's used by the DoD to try to gauge the amount of risk associated with any individual contractor that they're thinking of doing business with. It doesn't just have 800-171 compliance information in it. It's actually got other types of things that are kept there, like your past performance. But at the end of the day, it's exactly what it says it is. It's the amount of risk associated with the performance of a supplier to the DoD. And so it's a tool that they use to compare and contrast and gauge that risk associated with contractors they're either thinking of awarding to, or they're going through the procurement phases. So this is where that information is kept for them, along with a lot of other information. And the system is actually part of a bigger system that does other things. The SPRS score range for 800-171 compliance is actually 313 total points, where it goes all the way from the worst score of -203, that means you've done absolutely nothing and you're completely unprepared, to the best score, which everybody wants to get. And from what I hear, there are so many people that have 110 in the SPRS system, and that's actually a huge red flag for those of us that are going in to consult with those organizations. So many contractors that we talk to are like, oh yeah, we've got 110 in the SPRS system, and they're just really confident that they're completely ready for CMMC assessments, but they just don't understand. And the first thing that I can tell you is you should send somebody in your organization to either CCP training or RPA training so you can understand what is headed your way, but also to accept that it is actually headed your way, and much faster than I think most realize. There's a lot of denial out there, and there's a lot of false hope, and there's a lot of incorrect scores here in the SPRS system. So let's talk a little bit about this score range. So the best you can do is 110. And if you were to not do 110 requirements, how come you wouldn't be at 0? That's what people don't understand. Well, to me, it's like some guy just, in true DoD fashion, the SPRS system was developed for a 0 to 110 range type scoring. However, afterthought, they wanted to weight each of the requirements as being high, medium, and low level as far as their impact goes when you talk about the risk associated should that requirement be not implemented. And so, they're like, well, we already got this SPRS system and it's based on, 0 to 110. We're not changing that. And so they were just like, all right, well, let's just let the scores go all the way down to whatever negative number they need to after we apply these weights to each of the 110 controls, rather than just correcting the entire system and making it a 0 to 313 scale. It's now a -203 to 110 scale. I made up that story, but I bet you anything that that's kind of like what happened. Okay, so we have to go through each of the 110 requirements and look at their weights, which is the number of points associated with that requirement, to understand where the 313 comes from. Let's go ahead and do that now. Okay, so I've popped all of the requirements related to CMMC from NIST 800-171 into an Excel spreadsheet. And if you want the one that's easy to paste into an Excel spreadsheet, there's one on Wikipedia that's perfect. It pastes in just wonderfully. That can be hard sometimes when things are in a PDF. Anyway, I have all the requirements here in this Excel spreadsheet, and I have their practice number, the requirement description, the value or the number of points that the SPRS system assigns to that particular requirement. And then there's room for comment there, but they've actually commented, and we'll talk about those comments and some of the exceptions in just a minute. But at a very simple level, if you were to go ahead and scroll all the way down to the bottom, you can see that some are worth 1 point, some are worth 5 points, some are worth 3 points, right? There are actually 44 that are worth 5 points. There are 14 worth 3 points, and there are 52 worth 1 point, if you wanted to break it down. Anyway, when you get down to the very bottom, you should expect that if you summed up all of that, it would be 313, and it actually is. So the formula is to sum up that entire column, and so that's where the range from negative 203 to 110, which is a total range of 313, is coming from. And so you start with 110, and every time that something is not met, then that number of points is deducted from the 110. The only exception, all of them have a set value. You don't get like, a score of 1 through 4 or something like that. It's a set value or number of points that each requirement is worth, except there is an exception, and that is with FIPS validated encryption. Let me go ahead and find that one. Right here. Here we go. Okay, employ FIPS validated cryptography when used to protect the confidentiality of CUI. All right, so what we have here is one that you may get 5 whole points deducted. However, if you've got almost all of it going, but are missing just a small component, like it fell out of validation, or you've got some but not all, then you could end up getting only 3 points deducted. If you want the details of when you deduct 5 versus 3, it's pretty specific in the cap. I won't get into it because also this seems like it might be changing. NIST is, I went to a conference this week, and for the first time I really heard them, and actually it's not the first time, I heard it once before, but it's almost like a possibility that they're going to change this practice and the way that they're viewing it, because there is a problem with validation falling out of compliance when you add patches and things like that. So again, I won't tackle all the things that go along with FIPS. That could be a whole another video, but just understand that you could get 5 whole points deducted there, or if you have a certain level of implementation going, you could get, and you fall into what the cap is describing as the only deducting 3 points, that could happen too. Either way, I gave it the whole 5 so that if you didn't have it, it deducted 5. And that's where that 313 is coming from. Okay, so you're starting with 110 points and getting the number of points that are designated here under the value deducted if a practice or requirement is not met. Hopefully that makes sense to you. And the assessor will decide whether it's met or not met. So in a CMMC assessment, they're just literally coming through, and if you had another column, it would just say met or not met. And you literally have one or the other on every single practice. Okay? And how are they deciding whether it's met or not met? They are looking at the objectives of that requirement. If you look at 800, 171, A, or even just 800, 171, I keep it handy all the time right back here. You would see that every requirement has objectives, and so you really could break each requirement down into several different objectives, and you need evidence for each and every one of those objectives. Evidence has to be sufficient and adequate. That means that there's enough of it, and there's also the type of evidence that is provided proves that the requirement is being met. All right. So hopefully that clears up for you where that 313 point range is coming from in the SPRS system. Okay, and what we say, now if you just got rid of that column and you didn't pay any attention to it, when we talk about POA&Ms, if you were to kind of remove all of the requirements here that are worth 5 and all of the requirements here that are worth 3, the ones that are left over are the ones that could potentially have a POA&M if they were not met. You're not allowed to have a not met on any of the 5-pointers or any of the 3-pointers. That means the assessment is over, and you unfortunately would not be able to pass that assessment, and you would have to be reassessed if there's any 5-pointers or 3-pointers that were not met. But the 1-pointers, a certain percentage of those, if you've gotten up to a certain number of them met, there are some POA&M options for the remaining items if they're not met. The limited practice deficiency correction is meant for very small problems, like it's for little quick fixes. So you've got all your ducks in a row, the role has been assigned, you're doing it at a certain interval, you've demonstrated some very clear evidence that you're meeting the requirement. But we've noticed a small problem on the policy. It could be like a signature is missing, or it's outdated, or it doesn't perfectly align with the amazing procedure that you just showed us. It was obvious that the person that we interviewed has been doing this a long time, and they're doing it very well at the intervals that you wanted them to. But there's something small documentation-wise that needs to be addressed. We can't tell you what to do. If a signature is missing, we could just say, there's some signatures missing, this policy needs to be updated. But if it has to do with how to write your SSP, nobody on the assessment team is allowed to tell you anything like that. We can only tell you that the procedural documentation needs to be fixed related to a certain practice, and that it qualifies for a limited practice deficiency correction, which means that you don't have to POA&M it. It can actually get done before your assessment ends. It's like 5 days. If you can fix it in 5 days, we're gonna check it before we close out the assessment, and you could actually end up, if that was the only problem, getting your full on level 2 CMMC certification. If you're not able to correct a limited practice deficiency correction within within about 5 days, I think it's going to be 5 days, then it would move on to POA&M status, and then you'd be in the interim level 2 certification mode and have to be reassessed once those POA&Ms were corrected. So the however to this is that the practice evidence must demonstrate the implementation has been in place for a period of time. So like I said, it's where you're doing excellent as far as what we're viewing as far as the requirement goes and who we've interviewed and the evidence that was presented. There's just a small documentation problem. That's where you're going to see this utilized. And there must be consensus among the C3PAO assessment team that the practice in question does not change or limit the effectiveness of another practice that was scored as met. That makes sense. All right, so hopefully that cleared up some of the questions you may have had about the SPRS range and the scoring system there and how it relates to your CMMC assessment. If you're having trouble figuring out how to enter your SPRS score for the first time, please reach out. I can definitely help you with that. And if you'd like to see a video, although there are a lot of good videos out there on it, I can definitely do that as well. And so give us your feedback on what you're wanting to know more about, and we'll try to do more videos, maybe a little less math and a little more about something else. All right, have a great day, and thank you for watching.